Welcome to the Dental Marketing Guy Show. I'm Justin, the Dental Marketing Guy, and today I have Jessica Martin. She is a consultant who can help you. She helps with spa dental offices, helping you create a really nice environment. Wants the same thing. Not every dental patient wants the cheapest crown or the fastest this or that. And in fact, most patients don't know about dental technology as much as you do. So one of the things that I've found really effective in working with practices is the word of mouth marketing that you can get from the patient experience can take your marketing, whatever you're spending on marketing, whether it's Google or Facebook or whatever's coming in for traffic to your website. It's really amazing to get that word of mouth on top of that. It just compounds the effort, and your return on investment, it just skyrockets. So yeah, we're going to get into some actionable tips. We're going to talk about some quick tips that you can use to maybe you don't want a full-blown boutique spa dental practice. Most of you probably don't, but for those of you who might want to take it just a step up, just give people something a little bit nicer and something to talk about, because they're not going to talk about your CEREC. They're going to talk about some of the things that Jessica is going to tell us about. But first of all, how are you?
I'm great. Thank you for having me.
It's a pleasure. It's a pleasure. Yeah. And so let's talk a little bit about first, because you're going to give us some tips on things that dentists can do. But first of all, how did you get into dentistry, and why are you doing what you're doing?
Sure. So my husband is a dentist, so kind of married into it, so to speak. And he's been practicing for about 14 years, and we purchased a practice about 8 years ago that was great. It was an existing practice, but it wasn't growing in the way that we were hoping or as quickly as we were hoping. And so my background is actually in school psychology and special education. I was a director of special education for a number of years. I have a school counseling license. So I came from a different perspective when it came to owning the practice and looking at ways that we could differentiate and help the practice grow. So that's when the dental spa concept was kind of born out of that necessity to stand out in our community, also maintain a quality type atmosphere. But really, I wanted to change the experience for people, because I kept hearing over and over that people avoided going to the dentist or dreaded going to the dentist. And I thought, in my experience with working with children with struggles, I know there's things that we can do differently if we just understand what it is about the experience that the patient is hesitant about, or what bothers them about the experience. So that's sort of how that, we call it a dental spa, but it's really a lot more than that. It's really about tailoring the experience for each individual. And that sounds really comprehensive, and it is, but it's really a lot of little things that you can do to make a huge difference.
Cool. Yeah, let's dive into what's one of those little things.
Yeah. So what I discovered in really thinking about the typical dental experience in more detail is that it's really a traumatic event. It's trauma on our sensory system is what it is. So we greet people warmly, we sit them in the chair, but then we lay them back and we put them in this vulnerable situation that most people don't really care to be in, laid back, feeling like they can't talk, can't communicate. So asking them in the front end of things as they're a new patient, what about the experience is good for you and what about the experience isn't good for you? Because we all have different sensory tolerances. And so there's things like certain touch that bother people. There's things about of noise, certain noises that bother people. There's things about the smell that bother people. And so we can understand what aspect, or maybe it's all of them, but what aspect of the experience is problematic for that person, then we can control that a little more.
So do you, on the new patient intake forms, do you ask these kinds of questions? And then you also ask at the front desk, and you also ask chairside. How does that process work?
Yes. So I've developed a form that we utilize as part of the new patient forms that does detail what parts of the experience might be problematic. It also asks about, previous trauma that the person might have had, things like that. And so that's a place for them to fill that out on their own. But then also in that comprehensive new patient exam, the doctor really dives into that in a little more detail too, because some people aren't going to be forthcoming. So I find you have to kind of work it both ways. Some people will be really maybe more comfortable doing it, writing it out on the form. And then other people might be more comfortable once they really start talking with the doctor about, oh, you've had some, past experiences that were traumatic. Can you tell me more about that? And so you kind of have people on both sides of it. We don't really address it much at the front desk other than just making sure they've completed that comfort form.
This is actually kind of interesting because yesterday I had a dental emergency. I had a minor, not an emergency. I guess I made it an emergency. I'm a high maintenance person. But, it's a little chipped tooth. Not a big deal. But I knew a dentist from Dentaltown in my city, and he was able to get me in right away. And I'm filling out this patient intake form, and I'll tell you, there were certain things that I didn't necessarily want on the form, but I'd be perfectly comfortable telling the dentist. I could totally see how that works. And I'll tell you, it's very interesting for patients who find a dentist on Google. We found that the way you ask, how did you hear about us? How did you find us? Just those two differences in the way that you ask can yield a completely different answer. It's almost crazy because it's like, well, okay, let's assume both answers are true. You heard word of mouth and you also Googled and you also read the reviews, so if you ask three different ways, you're going to get three different answers. And the truth is that they're all true, but sort of pinpointing the exact sort of the initiation. A lot of times Google is the initiation or word of mouth is the initiation, but then there's this vetting process and all that, and they check out the website. So that kind of makes sense because we've found that if you answer the phone and you say, how did you hear about us or whatever, or how did you find us, you're going to get a certain answer. And then when they come into the practice on the intake form, you're going to get a different answer. And then when you take them to the chair, you're going to get a different answer. And so it's actually led to kind of a tracking issue when it comes to SEO, and it's one that's we've paid very close attention to. So that's very interesting because at first when you said it, I was like, really, do people just kind of hold information back? But then as you're explaining it, I'm like, actually, they do.
They do. And what's interesting is that what we found too is that when you poll people that have been in the practice for years and years that you thought they don't have any dental anxiety, they seem totally calm when they're here. I don't know why we really need to ask them this. Then when you actually do ask pointed questions, they'll say, yeah, actually, I am really anxious when I'm here. I just get through it, but they present really well. And so unless you ask that question, maybe it's on the form and what that appeals to them, they're able to write it out, or maybe it's the dental assistant before the doctor comes in that is reviewing the form with the patient, starting that discussion, or it's the doctor that's addressing it directly in that medical history part of things. People are interesting creatures, and their comfort and how comfortable they're going to be willing to share and where they'll share is going to be evident, but you need to have it in multiple places to make sure you hit that.
Okay, so that makes sense. So finally, they give you the information. It's like pulling teeth. No. And then what? So if they say, oh, the sound of the drill in the next operatory bothers me, I don't know, do you give them headphones or noise canceling headphones? I mean, it seems like some of these problems are easy to solve. Some of them are very hard to solve, like smell. That's got to be an extremely difficult one to solve. So how do you solve these problems?
Yeah, so there are a lot of little things, as I mentioned, that you can do to solve the problems. For the noise, definitely the noise canceling headphones. If you're, in an office where you have the luxury of having a television or music where you're able to pipe something in to just distract them and, just take the edge off the sound of that drill, that can make a huge difference. With regard to smell, I recommend diffusing essential oils. That really just can create a calming atmosphere and just the scent itself, but also it's going to, decrease that dental smell that is just very common in dental offices. So there's lots of little things. And then the other thing, kind of going back to the patient check-in part, is that what I recommend is each patient gets an amenity checklist where they can choose a number of amenities that really appeal to most people. So there's a heated neck wrap, there's a knee pillow, a blanket, a cooled cucumber eye mask, and then a mini massage that our assistant will do at the end. And so all of those things kind of just take the tension or the anxiety that might be there and just kind of dull them a little bit. Oh, this is nice. This feels comfortable. This is a place that I can feel okay about. And then as you go deeper into knowing what specific things might trigger that person, then you really just tune into making it more enjoyable, because you're eliminating as much as you can that causes them discomfort.
I'm not sure if this statistic's accurate. I should probably look this up because I use it a lot. But I've heard in numerous authoritative sources that about 8% of people have dental phobia, like full-blown phobia of the dentist. And then, of course, there's a much higher percentage of people who are just generally averse, maybe slightly fearful of the dentist. Do you find that these techniques are most effective for those people? Or do people in general, are you surprised that everyone likes this kind of?
I would say we've been pleasantly surprised that 90% of people like the spa atmosphere, the spa amenities. Even if you don't have any level of dental anxiety, it's nice to be pampered. It's nice to feel cozy and warm and feel good and feel like someone understands you and is taking your comfort in mind. I think if you start with that, the patient gets the idea that they really care about my comfort. They're certainly not going to want to hurt me. They're going to take their time with the clinical side of things too. I think it just sets their mind up for the whole idea that this is going to be a positive experience. So I think it can be good for anybody. But we've also seen people with pretty severe aversion that have put off going to the dentist for years and years, that have come in because they've heard through word of mouth. As you mentioned, it's huge when you start really appealing to people and what they need and what they want, that have come in and they have put off so much care, and now they need hours and hours of dental work, unfortunately. And this has helped them tremendously, to the extent that they haven't had to go the conscious sedation route or IV sedation route that they, probably would have had to otherwise. That's a nice offering, but there are other factors with that too. So this is a nice way to really just calm that nervous system down and get people comfortable. And like I said, it appeals to everybody. There's a few people that, I've run across over the years that don't want any of it, and that's okay, because it's all optional. It doesn't necessarily change everyone's experience.
Yeah, and there's a whole thing about the opiate epidemic, they call it. There's a lot of people who probably ask for drugs in the dental scenario specifically because they have anxiety. It's like, how are you supposed to go into a dentist? You're fearful, and then it's just like the last dentist that you went to, and it's not pleasant and it's painful, and no one's asking you if it's painful. That's the presumed experience, is that there's pain and no one really cares. And it's kind of crazy if you think about it, that people pay for this, unless they're masochists. I don't know, but about the psychology. I just think that it's very obvious that people don't know the clinical skills of the dentist, but they do know how they feel. They know the pain level. They know if they feel somewhat in control. I mean, of course, you have to relinquish some control when you're at the dentist, but a lot of people have a problem with that. And I'm sure you're familiar with this, but a lot of people, you lean that chair back without asking, and they do the crunches. It's like people who haven't been to the gym in 15 years are all of a sudden doing sit-ups. All of a sudden they care about their health. But it's kind of funny, because it's like, well, hold on a second. You wouldn't just pull a chair out from someone as they're sitting. You wouldn't just push someone out of the chair. So why would you lean the chair back? Because you're the dentist? Because you're so powerful in this position? So maybe you could talk a little bit about that, where, how much of this is the psychology of just letting people know, like, we care about what you think, and we care about consent, and we need your permission. Unlike other people, we ask for your permission before doing something.
I do think that's a huge part of it. And a part that I'd like to dive into even more is really about being trauma sensitive, because as you mentioned, most people feel vulnerable being laid back in that chair. But for people that have experienced significant trauma, in any form, whether that's, having been in war, sexual assault, whatever, being in a vulnerable position is going to be difficult for individuals that have experienced that. And so I think we have a duty in our in our field to make people's comfort a priority, and to make sure that they do feel as in control as possible. I do a lot of research for dental offices, and I look at their websites, and it's funny. I kind of laugh because almost everybody says, we provide personalized care in a comfortable atmosphere. I mean, everybody says that. And I know that everyone has intentions of that. Everyone's trying to do that. But I think we've gotten stuck in the ways that things have always been done. And that's why I feel like this is so important to think outside the box of what more can we do. And, I remember when I presented it to my husband for the first time, who's, he's a perfectionist. He wants to run a great business. And he said, well, I don't want to add a bunch of time to the schedule. I want people to be comfortable, but I can't really worry about that so much. I mean, I want that, but how do we fit that in? And so that's been something that we've perfected over the years, that of how to appeal to those specific triggers, and how to really respect people and understand people, and make sure they're comfortable, but how to do it efficiently so that it doesn't affect the schedule, so that it doesn't create a bunch of extra work for your staff.
In your practice, so you say you've been refining this for years, like how much time is added on average? Like obviously it's different with different patients. Some are going to be totally low maintenance, and they're going to be like, I don't need no pillow, I don't need a massaging chair, and those things probably don't add much time, but some of these things might add time. And so I would presume that a lot of the more advanced clinicians who might watch this, they're shaking their heads like, well, just like your husband, hey, this isn't science. We're not counselors. We're not, this isn't marriage and family therapy. This is clinical work. But I agree that people, dentists want people to feel comfortable. So what is the time added is there like an average? Does it depend on the patient? Like what, in terms of, say someone wants to implement a lot of these things and make people feel truly comfortable and get that word of mouth marketing, which is the best marketing out there. How much time are we talking? Are we talking extra 10 minutes chairside with the dentist? Is it with the assistant? What are we talking?
We're talking, if someone chose every amenity that I recommend, and every accommodation, if you will, that I would recommend, that there might be possible, a max of 5 minutes. And that's including the front end of the appointment and the back end of the appointment. Now that's in the chair. Some of it I would recommend doing upon check-in. So, getting the list, or getting the person to identify what spa amenities they want just off the gates, those pampering kind of options, that's done in the front. So assistants prepare for that, but a lot of that can be done as they're getting ready to seat the person. So really, truly additional chair side, I would say a matter of minutes. So in our practice, we didn't change our scheduling times at all. If that gives you an indication, we didn't add any time to a crown or filling or anything. We kept everything as it was, and these things were, like I said, done moments before the doctor would walk in a lot of cases.
I wonder if, and this is a little speculative, maybe you can speak to this, but I wonder if you actually might save time, because if people trust you, I don't ask my dentist any questions, I probably should, but I don't really grill him. I don't cross-examine him. I don't say, well, what about this and that? I might, eventually if it's a big procedure, but the point is he probably saves time with me, because I'm just going to be like, sure, thumbs up, doc. Do you think probably one of the reasons why you haven't added time, correct me if I'm wrong, is because of that factor? Do you think that plays a role?
Absolutely. That's a great point. We've seen case acceptance become much simpler. Like you said, people, they're comfortable, they feel at ease, they're trusting. I mean, who doesn't like people that are comforting them and concerned about them and understanding them? It's just, it's a way to get that buy-in. I don't like the word buy-in, but it's a way to get those treatment plans accepted, and for the person to be instantly comfortable without, I still recommend, you come in as the doctor, you do a little small talk, but you're coming into a really warm patient. They're happy. They're in a good place because they're comfortable. So it's a lot different than walking in and they're just sitting there like just bracing themselves, just waiting. What's he gonna do? What's she gonna do? Yeah. So I do think that affects the overall timing of things.
So you get that patient intake form. You ask them at multiple times in their appointment. So you get the information, you get the data.
Mhm.
What are some more actionable tips that we can do? What are some of the more common things that you see having a positive impact?
Yeah, well, regarding, I thought you were going with what do you do with it now, or how do you make sure that the experience happens that way the next time without having to go through as much of that. So I'll speak to that, but then I'll give you some tips too. One thing that's been important to me is just that once we've gathered that data, now we need to use it. We need to make sure that we're prepared as a staff the next time that patient comes in. Everyone's system for this could be a little bit different, but however it works in your practice, you could put in a chart note. This individual really liked the noise canceling headphones. They accepted the mini massage, they accepted the knee pillow. And that way it's almost like when you go to the bar and the bartender just hands you your drink. They know what you want. Not that you're not going to ask and say, hey, what would you like today? But you might say, your assistant might say, hey, I know you had the knee pillow last time and the headphones, you want that again, and kind of expedite and just let that patient know that you remembered and that it makes them comfortable. So anyway, out of my mind just kind of went there. That I think that's an important piece of preserving the data and making sure you're using it for the future. Some other tips, I think you mentioned at the beginning of offices maybe not wanting to transform into a whole dental boutique or have the whole spa feel. And what I would say to that is I don't think you need to do a ton to your building or to your treatment rooms. I think it's a lot of simple things that can be done to make it feel more spa-like, such as making sure you don't have a lot of clutter around your treatment rooms. I mean, I think dentists are notorious for having all the little vials of things and all the tools and the trinkets out, and as much as you can really clean that up and make sure that the person's not walking into a room where they're like, what is all this stuff and what are they going to use on me? Just declutter. The decor, you can again take that spa angle of using neutral colors, calming colors, nature, pictures of soothing things rather than, I don't know, we used to have a big picture of like some teeth in the waiting room of, before and after. And I mean, it was maybe nice to show people what was possible, but it didn't feel calming. It felt very clinical. So just keeping that in mind with decor, excuse me. I think, you can bring in spa elements other ways too. It's really simple. Fruit infused water in the waiting room rather than bottled water. Just a nice little touch makes you feel like you're somewhere, more spa-like. Having diffusers running, I recommend one in the waiting room, in the front office area, because that tends to kind of flow into the waiting room, in each treatment room, and really just make the place smell nice and get that calming feeling going. I'm just trying to think of what other little things.
That fruit thing, that really makes a big difference because, if you go to a nice hotel, that's what they have. They don't, they might give you bottled water and all that, but they have the container and it's either mint or fruit or something like that. So that is, if you look at hotels and spas and stuff like that, like they've figured out that there is a return on investment on these things. They're not doing it just to be nice. They're doing it so that they can make more money. And that makes perfect sense, right? Less wait times, more amenities, these types of things. You can always, and not every dental practice is going to be set up this way. You can be the Motel 6. You don't have to be the nicest hotel in the world. But yeah, I could see how that makes a difference. And I've also heard of practices using like arm massages, actually having the assistants trained in arm massages. I don't know. I mean, not everyone's a big fan of that, but I bet you a lot of the patients are. And of course, consent. Just because there is coffee in the waiting room doesn't mean they have to drink it, and vice versa. The massages and all that. And so, yeah, I think that's a really interesting point. So it seems like there's other things though. So we've got noise canceling headphones if they don't like the sound. the aromatherapy or essential oils if they don't like certain smells. What about vision? What about, like, do some people use
Mhm.
something for their vision?
Yes, so that is where the cucumber eye mask can come in nicely. It just we what I recommend is but not real cucumbers. You could use real cucumbers, but we have the little ones that are nice and easy to disinfect. But it just covers their face so that again they feel like they're at the spa, but they're not seeing hands coming toward their mouth. They're not seeing the tools. The other thing you can do with regard to someone that's doesn't really want to see what's happening is making sure that either the tray of tools isn't in the room when they're being sat, or more efficiently that it is in the room but maybe covered with a towel or some kind of a something, just so they don't walk in and look at all the tools. That can be really jarring. So those are two things with regard to vision that I think can be helpful. You just have to be careful with the cucumber eye mask that you want to make sure you put that on after you're done kind of having that conversation with the patient to make sure they don't have any questions. We definitely wait until the doctor's in the room so that there's that eye contact and that personable feel. But then once they're laid back, that's kind of when that eye mask can go on and they can go into their Zen world from there.
So before we go, what's the number one thing, and this may be a tough question,
Yeah.
but what would be the number one thing that patients remark on that, more than anything else? Is it the cucumber mask? Is it just the atmosphere? Is it, what would be the one thing that you've seen in your practice that is people just love to talk about? They're just wowed by it.
That's hard. That is hard. The thing that most people will take advantage of out of everything is the heated neck wrap. So it's one of those, I don't know, gel. It's got little gel things, beads inside of it. You pop it in the microwave for a minute, throw it on their shoulders, just relieve some tension. It's warm. Even in the summertime, shockingly, people still go for that. And I'm not sure if it's so great. It is really great. It feels amazing. And a lot of we actually use them too. And we get tents at the front desk, or, the clinical staff, they have a moment, they'll put one on just to feel a little bit better, but it is great. But I think part of that has been one of our hygienists. She kind of she likes to challenge herself to see what she can get people to accept. And she was actually the toughest critic when we started this whole concept. She's like, people aren't going to like this. We're in a small town. People just come to get their teeth done. So when she kind of took initiative and said, all right, I'm going to get people to do these things without forcing, of course, making sure that they were comfortable, but just encouraging. So she would, upon check-in, even if they didn't choose the heated neck wrap, the first probably year or two that we had this concept rolling, she had one of those ready for every patient, and she didn't put it on unless they consented to it. She said, hey, I got a neck wrap ready for you. Come on back. And the burliest men that were like, I don't want any of this stuff. We have a few of those. They were like, all right, that's fine. Put it on. And they realized that how wonderful it was. And so I don't know. I think that's maybe part of it because it's simple. It's memorable, but it also feels really good. So I think that's been the biggest hit out of all of the items that I would recommend. But
I had to pull it out of you because I don't know if you mentioned it before. We'll have to play
no.
back. Rewind, everybody rewind. She was holding out on us there. Now, well, cool. Hey, so obviously you teach about this. You've got a blog. You obviously know what you're talking about. Where can everyone find you?
Yes. So my website is www.martinmanagementllc.com. That is my website. I'm also on Facebook, of course, as well. But yeah, it's great to be able to help other offices to put this into place quickly and efficiently so they can see the return on the investment right away. I mean, it took us years to perfect all the efficiencies of it. And so that's what I love to be able to offer is that, you can start this rolling and see return on within a month or two. It's pretty great.
I'm always saying word of mouth. That's where it's at. And it's all about the substance. And for those of you clinicians watching this, and you might think, you know what, this foo-foo stuff, it's not about science. It's not about better results. Well, if you can't get patients to refer to your practice, If you can't get patients to accept treatment, then you're underutilizing your skills. So this is definitely very powerful. So thank you, Jessica, for coming on the show.
Thank you so much for having me.
And thanks for watching the Dental Marketing Guy Show.